Which of the following muscles controls the amplitude of sound waves in the inner ear? A. The stapedius. B. The auriculaires. C. The ciliary muscles. D. The lateral rectus. The answer is A. The stapedius. The stapedius, the smallest muscle in the human body, controls the amplitude of sound vibrations pulling on the neck of the stapes. The auriculaires move the ears. The ciliary muscle and the lateral rectus are both muscles of the eye. What is the action of the superior oblique muscle of the eye? A. Elevates the eyelid. B. Externally rotates the eye. C. Depresses and internally rotates the eye. D. Elevates the eye. The answer is C. Depresses and internally rotates the eye. The superior oblique originates on the annulus of Zinn and inserts into the outer posterior eye. Its action is to depress and internally rotate the eye.
Which of the following innervates the platysma? A. The motor accessory nerve. B. The facial nerve, CN7. C. The vagus nerve. D. The mylohyoid nerve. The answer is B. The facial nerve, CN7. The platysma, a sheet-like muscle that traverses the neck from the clavicle to the mouth and jaw, is innervated by the cervical branch of the facial nerve, CN7.
Which of the following muscles has its origin on the mastoid process of the temporal bone? A. The semispinous capitis. B. The splenius capitis. C. The rectus capitis posterior major. D. The rectus capitis posterior minor. The answer is B. The splenius capitis. The splenius capitis, one of the main extenders of the neck, has its origin on the mastoid process of the temporal bone. The rectus capitis posterior minor, the rectus capitis posterior major, and the semispinous capitis all originate on the knuckle line of the occipital bone. What are the main muscles responsible for keeping an upright spinal position? A. The levators costarum. B. The rhomboids. C. The erectors spinae. D. The latissimus dorsi. The answer is C. The erector spinae. While all of the muscles listed are part of the structure and mobility of the back, the main muscle group responsible for maintaining erect posture in the erector spinae. Which of the following is not a part of the erector spinae muscle group? A. The iliacostalis. B. The longissimus. C. The spineless. D. The trapezius. The answer is D. The trapezius. The main muscle groups that make up the erector spinae are the iliacostalis muscles, the longissimus muscles, and the spineless. The trapezius is not a part of the erector spinae group. Which of the following is a muscle of mastication? A. The temporalis. B. The lateral tragoid. C. The medial tragoid. D. All of these. The answer is D. All of these. Mastication relies on four major muscles: the masseter, the temporalis, the medial tragoid, and the lateral tragoid. Which of the following cranial nerve, CN, innervates the genioglossus? A. CN4, the trochlear nerve. B. CN12, the hypoglossal nerve. C. CN9, the glossopharyngeal nerve. D. CN7, the facial nerve. The answer is B. CN12, the hypoglossal nerve. The genioglossus, the main muscle that protrudes the tongue, is innervated by the hypoglossal nerve, or CN12. What is the origin of the inferior oblique muscle of the eye? A. The sphenoid bone. B. The infraorbital margin. C. The annulus of Sien. D. The maxilla. The answer is D. The maxilla. The inferior oblique muscle of the eye, an extrinsic muscle that externally rotates and abducts the eye, has its origin on the orbital surface of the maxilla. What is the action of the sternocleidomastoid? A. Laterally flex the neck. B. Accessory respiratory muscle. C. Extend the neck. D. All of these are correct. The answer is D. All of these are correct. The sternocleidomastoid, a long muscle that originates on the manubrium and the clavicle and inserts into the mastoid process, has several functions. When functioning unilaterally, it rotates the head, flexes the neck, and laterally flexes the neck. When functioning bilaterally, this muscle also extends the neck and is an accessory respiratory muscle. Calcium is required for all of the following except dash. A. Muscle contraction. B. Nerve conduction. C. Blood clotting. D. All of these require calcium. The answer is D. All of these require calcium. Calcium is essential for many processes of the body, including but not limited to nerve conduction, muscle contraction, blood clotting, and bone mineralization. Which of the following lists the zones of mitochondrial ossification in the correct order? A. Resting, proliferation, maturation, calcification, ossification. B. Maturation, proliferation, resting, ossification, calcification. C. Proliferation, calcification, maturation, ossification, resting. D. Proliferation, maturation, resting, calcification, ossification. The answer is A. Resting, proliferation, maturation, calcification, ossification. There are 5 distinct zones in regions of mitochondrial ossification. These are the resting zone, the zone of proliferation, the zone of maturation, the zone of calcification, and the zone of ossification. In what zone of mitochondrial ossification do the chondrocytes typically die off, leaving cavities for colonization by osteoprogenitor cells? A. The zone of proliferation. B. The zone of ossification. C. The zone of maturation. D. The resting zone. E. The zone of calcification. The answer is E. The zone of calcification. The behavior of cells in the zones of mitochondrial ossification is as follows: the resting zone, normal resting chondrocytes within hyaline cartilage. The zone of proliferation, rapid mitosis of chondrocytes. The zone of maturation, hypertrophy of chondrocytes. The zone of calcification, the death of chondrocytes due to lack of nutrients and inability to eliminate cellular wastes. The zone of ossification, migration of osteoprogenitor cells into the cavities left behind by dead chondrocytes and mineralization of newly formed bone. Which of the following mineral gives bone its rigid structure? A. phosphate. B. Calcium. C. Collagen. D. Hydroxyapatite. The answer is D. Hydroxyapatite. The rigid structure of bone is created by hydroxyapatite, a calcium apatite that contains both calcium and phosphate in the formula, CA5PO4, 3OH. Both calcium and phosphate are necessary to create bone structure. A deficiency of either will degrade the structural integrity of the bone matrix. Last, collagen is a protein rather than a mineral, and primarily functions to add flexibility to bone in order to prevent fracture. Bones are made up of which of the following three tissue types? A. Compact bone, white marrow, and red marrow. B. Cancellous bone, spongy bone, and trabecular bone. C. Cancellous bone, fat, and bone marrow. D. Cortical bone, cancellous bone, and bone marrow. The answer is D. Cortical bone, cancellous bone, and bone marrow. Bones are made up of the following three primary tissue types. 1. Cortical bone, which is the hard exterior layer, also referred to as compact bone. 2. Cancellous bone, which is the porous bone tissue that fills the center of bones, also referred to as spongy bone or trabecular bone tissue, and 3. Bone marrow, a hematopoietic tissue that fills spaces in trabecular bone. Which of the following is the term for the functional unit of compact bone? A. Lamella. B. Haversian canal. C. Osteon. D. Trabeculae. The answer is C. Osteon. The functional unit of compact bone is the osteon. The osteon is formed by concentric layers of compact bone called lamellae. These surround a central canal called the Haversian canal. Trabeculae are the functional units of cancellous, spongy, bone. Which of the following cells is responsible for depositing hydroxyapatite into bone matrix? A. Osteoclasts. B. Osteoblasts. C. Osteocytes. D. Myelocytes. The answer is B. Osteoblasts. Osteoblasts are the cells responsible for the deposition of hydroxyapatite into bone matrix. In addition to hydroxyapatite, they synthesize collagen, osteocalcin, and osteopontin. Osteocytes are undifferentiated osteoblasts, while osteoclast cells function in opposition to osteoblasts by removal of mineralization from the bony matrix. Myelocytes and normoblasts are both hematopoietic cells of the bone marrow and do not take part in bone mineralization. Which of the following is in the Haversian canal? A. Red bone marrow. B. Periostem. C. White bone marrow. D. Capillaries and nerves. The answer is D. Capillaries and nerves. The Haversian canal allows capillaries and nerves to pass through the cortical bone to nourish osteocytes, osteoclasts, and osteoblasts. Both the white and the red bone marrow are contained within trabecular bone, while the periostem is a thin, highly innervated membrane on the outside of bone. In regards to bone marrow, red marrow is primarily made up of underscore cells, while yellow marrow is primarily made up of underscore cells. A. Hematopoietic. Fat. B. Proliferating. Calcified. C. Active. Dormant. D. Erythrocytic. Leukocytic. The answer is A. Hematopoietic. Fat. Variation in color of bone marrow cells is not related to their level of activity, calcification, or the types of blood cells they produce. Rather, red marrow is primarily hematopoietic cells, both red and white progenitor cells, while yellow marrow is primarily composed of fat cells. Growth in long bones must occur at the dash. A. Epiphyseal plate. B. Diaphysis. C. Suture. D. Epiphysis. The answer is A. Epiphyseal plate. Growth in long bones occurs at the epiphyseal plate, a region of hyaline cartilage at the metaphysis of the bone. In adolescents and children, cartilage cells are ossified by osteoblasts to increase bone length. Once adulthood is reached, the epiphyseal plate becomes the epiphyseal line at the junction of the epiphysis and the diaphysis, the center of the bone. The diaphysis and epiphysis themselves are composed of mature ossified bone and do not proliferate. They are simply added to by transformation of cells in the epiphyseal plate. A suture is a fibrous joint of the cranium and does not contribute to the development of long bones. The length of long bones is increased via the hypertrophy and eventual apoptosis of chondrocytes, which leave cavities that are then colonized by osteoprogenitor cells. This process is referred to as dash. A. Osteoblast mineralization. B. Apoptotic ossification. C. Endochondral ossification. D. Endochondral mineralization. The answer is C. Endochondral ossification. Long bones are lengthened during childhood and adolescence via a process referred to as endochondral ossification. In this process, chondrocytes of the growth plate hypertrophy and eventual die, leaving cavities that are then colonized by osteoprogenitor cells. These osteoprogenitor cells then differentiate into osteoblasts, which mineralize the newly forming bone. None of the other answers are actual processes in bone formation or physiology. Which of the following is not a common site of hematopoietic bone marrow in an adult? A. Pelvis. B. Sternum. C. Skull. D. Tibia and fibula. The answer is D. Tibia and fibula. In adults, hematopoietic bone marrow is generally confined to the flat bones, including the sternum, the skull, the ribs, and the pelvis. Hematopoietic bone marrow also exists in the proximal end of the femur in most adults, but is not generally found in the tibia or fibula. Muscle is attached to the periostem of bone via which of the following? A. Articular cartilage. B. Sutures. C. Ligaments. D. Tendons. The answer is D. Tendons. Muscle attaches to bone via tendons, fibrous extensions of the sheath of the muscle body that are primarily composed of tightly packed collagen fibers. In comparison, ligaments attach bones to other bones without involvement with a muscle, such as the ligaments between the metacarpals of the wrist. Sutures are fibrous joints of the cranium, and hyaline cartilage is at the point of articulation of many bones, but it is neither incorporated into muscle structure, nor does it attach to the bone with which it articulates. Rather, articular cartilage primarily serves to allow bones to glide more easily over each other during movement.
The individual unit of muscle contraction in a muscle fibril is referred to as the dash. A. Sarcoplasmic reticulum. B. Sarcolemma. C. Sliding filament. D. Sarcomere. The answer is D. Sarcomere. The individual contractile unit of a muscle fibril is referred to as the sarcomere. These units are made of actin and myosin filaments and joined by Z lines. The sliding filament theory refers to the idea that muscle contraction is the result of myosin strands within the fibril pulling themselves along actin strands similar to pulling on a rope, which shortens the whole sarcomere. The sarcolemma is the specialized cell membrane around the muscle fibril, and the sarcoplasmic reticulum is the smooth endoplasmic reticulum found within the muscle cell.
Which of the following is the correct order of structures in a skeletal muscle, from largest to smallest? A. Fiber, fascicle, fibril. B. Fiber, fibril, fascicle. C. Fibril, fascicle, fiber. D. Fascicle, fiber, fibril. E. Fascicle, fibril, fiber. The answer is D. Fascicle, fiber, fibril. The largest unit of muscle tissue is the fascicle. Each fascicle is made up of a bundle of muscle fibers, and every muscle fiber is made up of many fibrils, called myofibrils.